Hello everyone. So today we going to talk about the fibromyalgia. So again we are ready with the live show. We have done a lot of exercises and all earlier. So a few agility, and then we have done for the geriatric care and that Pilates. So today I thought let's start with the more of the talk about the anything healthcare issues, because lot of thing in Indian health scenario we are not aware of the things, and this is not about the physiotherapy only. First, for Indian population, as we have seen in the COVID-19 time also, initial challenges for the government or anybody, it has become like more of awareing this 1.3 billion population. So today I'm going to talk about the fibromyalgia, and this I feel is a leading issue right now in the present scenario, and this is not about the developing country only. Even the developed country is dealing with the same problem, and this creates a lot of problem, and where the diagnosis and everything goes late because people are not aware of it much and how to deal with initially, and sometimes they do not get how they can handle it well, and it leads to the, it's like how you can say as the cancer and all, it was the problem at the scenario initially people get fear. So in future people have fear of knowing this word also, like that scenario. And this is actually first I'll say the overall view. So all over the world, almost 8 to 10% of the population is dealing with this problem, and this is equally, I can say, in the developed country too, and in the developing countries also. So developed country, again, there are also a lot of other factors are there, and developing country has the other issues. So but they both the countries are dealing with the same issue, and they both do not have the right solution for that one, because only one perspective not gonna help in to rectify this problem. There are a lot of other perspectives also matters. So first of all, fibromyalgia, what is this one? So it's exactly inflammation in between the muscle fibers, and this can be associated with a lot of other conditions and diseases, and could be alone too. And mostly the productive age group is the like targeted the things is generally age of 25 to 45 year of old, the male female both the population, but comparatively ratio is more on the female, and male is comparatively lesser. And you can say this thing leads to be, as I explained earlier, it leads to be with lot of underlying issues, and then we conclude this one fibromyalgia. So initially there is no right diagnosis for this one, and even patient is not aware of even right first line of the treatment also doesn't we go ahead with directly with the fibromyalgia. So first if a patient complains of sometimes random pain and aches here and there over all the body, and then it leads to be for them like gradually for some time, 2-3 months, and then 24/7, even high dose of muscle relaxant doesn't help them initially. So what happens, gradually patient doesn't even understand what is happening to the body, and they keep complaining of pain each and every time. Almost it's like it becomes daily routine. And especially for female, what happens, they assume it, okay, this is the part of the life, and gradually they go ahead with it. First of all, why it happens over there? One thing is lack of awareness, what is happening to the body, they are not understanding. Second thing, whom to visit if they know also that pain and aches, who gonna rectify that problem, okay? And again, if the rectification they get to also know there's, as I told you, there's a lot of perspective to rectify that problem. So they visit at one place, something they do, again reduce for some time, and again next level they get the pain. So again and again they get tired and fed up with the pain and aches. So first of all is count with all the joints initially. So sometimes it can be associated with any sort of the arthritis or the depression or the general muscle aches and pain, posture, type of the work what they do, and long hours of the sitting, and anything can be. And one common thing I say, what happens first line of treatment, as they complain of first any joint pain, so they visit any ortho, neuro, anything, and they do the line of treatment, and they cover they settle down the pain also for some time. But again the same pain triggers after the few months, and again they visit the medicine, again the duration of the treatment and the line of the treatment that goes quite longer time, and then again it rectifies. That cycle keep going on for 5 to 10 years down the line, and gradually they give up the body. And what happens in between, they start, because they are always in the pain and aches, they start getting lot of other depression and all, because they are in pain, continuously pain, and nothing works for them, one or other thing they keep trying. In between what happens, because lot of trial and error, body also recovery time slows down. okay, and that leads to the another level of problem. Their productivity is gone, and their fatigueness and all, their concentration, lack of focus, everything. So it impacts their personal, professional, all short of the life, okay, and still they're not getting the solution. So these are the things, that's what we need. First of all, awareness about this one, and then next the treatment, what we have to do it. So the awareness is the first thing. So fibromyalgia, that people need to be aware, and especially in the Indian population, and this is in any class. It's not about the only the lower middle class or the upper class. In any class this can happen, and people never get to know that is, it's underlying and leading to the in the long term problems. So, and first I have introduced about this fibromyalgia, and second thing is we're gonna do the statistical analysis. As I told you, even developed country, developing country, everybody is dealing with the same issue, and again it leads to the depression. And also what happens sometimes, if somebody is in depression, we treat only the depression, we do not think of the other pain index. Sometimes if the person is complaining of the continuous pain, we assume it could be the psychosomatic pain, and we just move on to the next level. We never think of, okay, could be like real pain. But if they talk about the pain, that is the real pain, it cannot be psychosomatic, we can conclude. So most of the time in this, when the patient visit to the clinic for pain index, so whatever need to be, get to know the long history of the pain first. That is very much important, very clear ki how it has started, and how long, what is their aggravating factor and relieving factors and all. And then we can conclude with something, is it generally triggers with any kind of emotional imbalances. So definitely ask the questions related to the emotional balances in terms of yes or no. Okay, so definitely, and again, not necessarily all the emotional balance will lead to the fibromyalgia, not necessarily. But again, see if again and again whenever they talk about, okay, if any time they get any type of more stress, their pain aggravates, could be the fibromyalgia. So these are the things we can reach to the diagnosis. And as everyone reaching to the diagnosis, we can go ahead with this one, and there is no specific test and these things where we can reach to that level. There is 18 pressure points in the body. Out of 18 we can reach to the 11. If minimum 11, then also it could be that pain, but not necessarily. Mostly I'll say more than that 18 point targeting, we should listen their history of the pain and how it aggravates and what is the relieving factor and all. That will make a lot of difference to figure it out. And again, it could be in the 3 stages: initially acute, then again moderate, and then advanced ones, so chronic ones. So whatever the line of treatment till now, there is, if acute and moderate, we can figure it out and we can find out, okay, this is the fibromyalgia. There is the good result, almost you can say 100% results are there where patient can recover back to the normal, as this happens in the productive age group. Again, recovery depends upon their another underlying issues too, their diabetes, BP, or any other thing, arthritis or anything could be, or that ways. And again, this thing, if it is in extreme advanced stage, because their patient start getting the touch pain, if anything, and even high dose of muscle relaxant doesn't help them to get their sleep and the pain relief. So that is, it becomes difficult. So 20%, you can say 80% only we can reach in that level, and 100% is really difficult to get. If depends upon the patient willpower only, you can say last 20% totally depends on the patient support and the willpower, how patient can do the environmental changes, their professional, personal, all the life changes and all. That will make a lot of difference over there. So these are the scenarios over there. So again, we'll come to the how the pain and X. Pain and X is like as I explained, 24/7 they get, and sometimes if their stress level is high, it gets aggravated more. And some particular muscles of overuse or underuse of the muscle, the type of physical activity or mental stress, whatever they're doing, that also can lead to be. And this can associated with the depression also, and could be at the initial stage or in the later stage. So again, with the fibromyalgia challenges, it could be, as I told you, associated with a lot of other things. So as I told you about the bone, muscle pain and all, so could be first arthritis or any muscular pain, and then it can lead to the fibromyalgia. It could be vice versa too. Same with the depression also. Could be first the depression has entered the body and then the fibromyalgia. It could be again the reverse also. So both the things. So we have to definitely, initial challenges to diagnose is the really challenging. With the history only we get to know, instead of anything other test and all, definitely. And one thing is till now what the very much of clearly has come up, their MRI definitely shows there is a changes in the brain if who has the fibromyalgia compared than the normal ones who doesn't leading to be. So that is the one scenario we can look into it. And as I told you, it's with each and every population can get, in each and every class. So awareness is first thing. If people will be aware of this thing, they can rectify initially without much treatment also. Okay. Second thing, with the lifestyle changes and all, if it has reached where you need the treatment, definitely first need to visit the ortho-neuro or the GP for to get the pain relief first, and then they can switch to the physiotherapy, and then their food changes and all this thing, anti-inflammatory diet they can switch to be, and lifestyle changes, even the counseling, more of counseling, what all the lifestyle changes they require. So that will help them to rectify all these issues. So that's what, if they visit one doctor or anybody, they do not get the complete solution. And in India or even in the developed country, we do not have any specific hospital or clinic where they only deal with the fibromyalgia. This will take another 20-25 years in the scenario where this is now it's become need, people are not aware of. That's the reason where right now for diabetes or anything, when we have problem, even for the cancer, we know which hospital or clinic we have to visit and which doctor. But for this one, we do not know. We just keep going randomly here and there. Then after 5-7 visiting the doctor, then we conclude this thing, okay, this is the fibromyalgia. Till the time it becomes really, it goes on the moderate phase, because that much of time we have lost the initially where it could have been, control the treatment much more faster. So these are the things, and this will lead, because this happens in the productive age group and male female both the population. So this affects lot of other things also, their lives, and if they are balancing in the life is the challenge. Personal life, professional life, everything becomes disturbed. So these are the thing, and this is very much of in sedative mode people get, people not even aware of that, okay, we are getting this type of problem. So these are the thing can lead to be in long term, and many people I have seen, how you can say, from acute to the advanced stage reaching is much faster also. It depends upon if they totally vary person to person. We cannot predict how much time it will take. Many patients comes with the 5-10 years of pain and aches, and then we conclude, okay, this is the scenario that happened. Few patients I have seen within 2 years it has triggered and reached to the advanced stage where they getting the touch pain. And when they start getting the touch pain, even recovery with the muscle relaxant and any other anti-inflammatory medicines also becomes difficult, because they are on the daily dose of the medicines, and they start getting the acidity and lot of other underlying issues. So these are the things, prognosis. So what my purpose to put it over here, this fibromyalgia is leading to be, as this is productive age group is more going to be affect, and in India or any other country, productive age group where they are taking care of the next generation of the kids also, and the elderly population also in the family. So it's become really problematic for them to balance each and every aspect, and they start going more and more in the depression and slowing down their productivity, and it affects their professional, personal life, everything. So first, in Indian scenario, we need to first, at the global aspect, we have to aware of the people. As we talk about any other topics or whatever happening around the world, we should talk about the health also, and health is not about only the exercising and everything. Knowing what can be happen and how we can control initial, and whom to visit and all. For any other services or the any other sector, we know where to go and what we can get it, even for the either bank services or any other thing. But still in the healthcare scenario, even in the developed country and in developing country, we do not know whom to visit for what reason. Few basic for the neuro ortho and all, very much of clear idea, but for fibromyalgia still patients are not sure whom to visit first, and where I'll get the solution. So this will take time. So initially first need to be aware, more and more educate the patients, whoever medical professional, to about this thing. So, and there are a lot of write-ups are there on the this thing internet and all, so we can go through if they see any type of shortened symptoms and all. And again, the symptoms and all can be first initially the muscle pain and all, then gradually it leads to be randomly the next time same area they can get the pain, and they can get the different areas of the body pain. And for females especially, it triggers with the any emotional balance or the post delivery or during the delivery of some other complications and all, then start getting the long-term pain and all. Could be these are the quite common reasons for the females to get. For male, generally what happens, again the emotional balance is one reason, and something few people what happens in the emotional balances, they clear it out and they just move on. Few people hold it longer, they lead normal life absolutely, but they keep holding that pain and aches, and that triggers the body over the time period. So these are the thing. Again, the overuse and underuse of the muscles. So must be somebody, like if even in the workouts and all, if somebody is doing too much of workout, which is not or some professionally they are in where they have to do more of workouts, so there also it can lead to be in the long term. And somebody is not at all using the muscles, again the fatigueness and all, lack of the movement of the muscles, that also can lead to the fibromyalgia. So these are the few factors which have to be rectified. And then again, if knowing all this symptom, that doesn't mean all the time we think of that can be the fibromyalgia only. A lot of other things are, because the symptoms are quite common with the other diseases and also could be. So these are the things we have to think of. And then how do we diagnose? As I told you, diagnosis is first very clear history of the pain onset, relieving factors and the aggravating factors and the emotional imbalance need to be asked. Very much of clear questions. And as in the first visit of the patient, they also get shocked, what is this something new term? Because when they come to you, most of the time what happens, they complain of some sort of the joint pain or muscle pain and the sciatica or the arthritis, any sort of. Then if you conclude it to the fibromyalgia, they get shocked, okay, what is this something new? So for that one, you can tell them, okay, explain the things and ask any sort of the emotional imbalance, yes or no answer. If they saying okay, and if you ask them how its aggravating factor is more of a stress is aggravates, could be the fibromyalgia, and then you can go ahead with the line of treatment. Again, side effects and all which you talk about. So if you plan of the treatment, whatever, especially in the physiotherapy or the food changes and all, it not gonna harm even if it's not directly the fibromyalgia this thing. Okay, because anyways it's more about the pain related. So instead of then the fibromyalgia, if you focus arthritis or something, you'll think of that particular joint and that particular area to pain relief. But if your line of treatment will be towards the fibromyalgia, you can think of the whole body ache to relieving. So it's just that root cause breaking down will be much more easier, and patient will feel much their fatigueness and everything will ease out. So even for sometimes trapezitis pain, if the shoulder pain regular, very much of common for them, but it could be that and initially sometimes we say okay, it could be the myofascial syndrome. But yeah, again the myofascial trigger point or the syndrome, there is a difference, but as a layman they do not understand what the difference. But as a medical professional they can explain, and then you can modify your line of the treatment and conclude that thing, okay, we can reach this solution for this one. And diagnosis, treatment suits. The treatment first line of definitely the muscle relaxant or whatever they require, other underlying issues, if antidepressant and all they require, that definitely need to visit that set of the doctors. Then it comes to the physiotherapy, exercise part and all. First again the level of the pain management. So there is again the lot of procedures which we can include, like dry needling, cupping, or chiropractic treatment, or their exercise protocols, myofascial release, all these are there. So see what works for you have to customize the treatment, okay, and see what works best for them. We have to proceed with that one. We cannot force each and every case will be same. So we have to customize totally according to the patient requirement, the treatments and all. So there is no fixed line of treatment again for that scenario. Third thing is comes to the food. Definitely it matters. There are anti-inflammatory diet or the detox diet that require, because as they keep taking the lot of medicines since long their treatment is going on, so they'll keep getting a lot of all the side effects and all. And if there is obesity, need to control on the weight also. So food changes and all, suddenly we cannot push them to exercise because they are already fatigueness. So we have to literally plan, and we have to customize based on the patient's time and how quickly we can get the result oriented. So that will help. Again, the lot of things are there in the physiotherapy also for them, so we have to see what is the best works for them accordingly. And again the food, as I told, so food definitely for if they require the weight loss and also we have to focus on that thing. And if we require only the anti-inflammatory, we can switch to that. Modification of the food is required. We cannot put something aggressively which body doesn't accept for them. So we have to go really easy one by one to see what works for them, and if they will get the changes, so they'll also get the confidence, okay, I should go ahead with this and I have to move on this one. So get the patient first confidence, okay, the recovery, something should show within a week time period, because they are suffering with the pain since long. Counseling is very much of important for them. Yes, they have to have patience if they have reached to the moderate level or the advanced level. Acute is very quickly to get result, but yeah, when it's reached to the moderate or advanced level, it takes time. So definitely we have to explain the patients very clearly that thing, it's gonna take time, so have faith and go easy. And their lifestyle changes is very much of important, that if they have any personal issue, they have to find out the way and deal with this one. And even if the professionally they are not in the very good healthy environment, they have to work on that to be. So a lot of mindset changes also matter. So counseling part also play a lot role in the chronic pain, because this is not something easy pain. So these are the things we have to give the guideline to the patient and keep thorough follow-ups, so that will help a lot to ease out with this thing and all. So these are the things. So what happens, as I explained about key for fibromyalgia, we need, even for the neuro ortho and all the pain management thing, even for the psychological support also, they need psychologist support also, and same time the physiotherapy and the diet and this thing. So there is no place where they can get everything under one roof. So this will take a lot of time. So patient, at least if they'll start awareing about this thing, so they can think of. So whoever medical practitioners also, I'll suggest to see if somebody comes, like guide them to where all they have to go and this thing visit, so that way they can get the result. So more often will think of getting the optimum result and their patient confidence, that will be more helpful, as this is the matter of more of productive age group, and everything, whole country's development, or everything GDP depends upon that age group. So we should think of this very serious note on that global aspect instead of only the practice aspect. And mostly the females are prone to this one, and nowadays it's more. Earlier also it was, as they were complaining, but no one would bother to listen this thing. Okay, they were assumed, okay, she has complained of the pain or X daily, so it's not the routine purposefully they say. And now they're getting more, because of they trying to balance their office and homework, both the things balancing. So in that balancing, they sometimes forget their body. They don't take care of their body well as much they need to, and they have always one reason to say that we don't have time for that one. But first of all, health have to take everyone as a priority. First you have to spare some time for your own health, whatever you do task, because you're not gonna enjoy if, like, same, there is a very basic example, they say if you have back pain, you're not gonna enjoy the long drive. So same way, your body not gonna drive longer time if you will be with the pain and X, and that will slow down the recovery and underlying, and one by one, if you're depending upon the medicines and longer term, it's not gonna give you the solution. Okay, so you'll get tired one day and then they feel like, okay, leave it, I don't want to continue with any sort of treatment. So all these things happens. So we need to, and to conclude this one, I'll suggest everybody to be aware of this thing, and as much as people talk about this thing, and even a lot of write-ups are there. The major challenge with fibromyalgia, international study is not yet done. The reason is we do not have the sample size of more than 1,000 patients at one place, because no one hospital or the clinic or any organization, healthcare, this thing, they're dealing with only with the fibromyalgia. Because there are hospitals for the more of maternity care or the advanced accident care or the cardio specialist, but there is no hospital who deal, or any clinic who deal with only with the fibromyalgia. So what happens, getting the sample size of 1,000 and doing any research is the challenge yet for developing and developed country both. Till now, whatever study has come, till the sample size was the 50 and 100, which is not you can say for international level, which can be come at the patent. So these are the things. But yeah, this line of treatment, because I deal with almost 80% of cases with the fibromyalgia till now, even sometimes even sports injury they come up with, and then what, even triathletes I have seen with the fibromyalgia cases, female triathletes, so mostly. So it can be diagnosed later also. So I have seen it was later on when I explain them, then they have agree with the things, okay, whatever the history has happened. So it's not necessarily only who is in the pain and aches in the sitting in the at home, they only getting. Even with the sports person who is highly active in any sort of activities on sports, they can also have the fibromyalgia. So these are the things, any age group, and also awareness should be there first initial stage, and as much as possible initially, if we'll reach to the conclude the diagnosis, it will be easy, the prognosis will be much better, and we can get the optimum result over there. Okay, so thank you everyone for listening for this. Hope you start doing the awareness for this one and all. Okay, thank you so much.